Radial nerve is the thickest branch of brachial plexus. Root value. Ventral rami of C5, C6, C7, C8, T1 segments of spinal cord. Course. Axilla. 1. Radial nerve lies against the muscles forming the posterior wall of axilla, i.e., subscapularis. Teres major. Latissimus dorsi. 2. Then it lies in the lower triangular space between. Teres major. Long head of triceps brachii. Shaft of humerus. 3. It gives 2 muscular branches. 4. It gives 1 cutaneous branch in the axilla. Radial sulcus. 1. Radial nerve enters into. 2. Radial sulcus where it lies between long and medial heads of triceps brachii along with profunda brachii vessels. 3. Long and lateral heads from the roof of radial sulcus. 4. It leaves the sulcus, front of arm. Radial nerve. Radial nerve descends on the lower and lateral side of front of arm deep in the interval between brachialis on medial side and brachioradialis with extensor carpi radialis longus on the lateral side to reach capitulum of humerus. Cubital fossa. Radial nerve enters. Lateral side of cubital fossa there. The radial nerve terminates by dividing into 1. Superficial branch. 2. Deep branch. The deep branch supplies 1. Extensor carpi radialis brevis. 2. Supinator. Then it courses between 2 heads of supinator to reach back of forearm. Front of forearm. Superficial branch leaves the cubital fossa. Then enters lateral side of front of forearm, accompanied by the radial vessels in its upper 2/3. At the junction of upper 2/3 and lower 1/3, the superficial branch turns laterally to reach the posterolateral aspect of forearm, wrist and dorsum of hand. The superficial branch descends till the anatomical snuff box to reach dorsum of hand where it supplies skin of lateral half of dorsum of hand and lateral 2½ digits till distal interphalangeal joints. Back of forearm and wrist. The deep branch of radial nerve enters the back of forearm, where it supplies the muscles mentioned, i.e. abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, extensor digitorum, extensor indicis, extensor digiti minimi, extensor carpi ulnaris. Then lower down it passes through the 4th compartment under the extensor's retinaculum to reach the back of wrist where it ends in a pseudoganglion.